My name is Dr. Shanti Eswaran, and I'm here to talk to you about Gut Matters 101. Welcome to this exciting day today at the Norton Educational Series. And we're going to have a lot of really great content to talk about with you. But first, I thought it would be great to talk about general GI physiology and anatomy so we can understand what's going on during the rest of the speakers today. So when we talk about the GI tract or digestive system or gut, what we're really talking about is a series of organs. And our digestive system is made up of a series of organs that allows our bodies to absorb nutrients and water from the food we eat. And as food travels through the digestive system, it's broken down, sorted, and reprocessed before being circulated around the body to nourish and replace cells and supply all of the other very important organ systems in our bodies. And usually this series of organs is doing its job kind of under the radar and unbeknownst to us. But occasionally, however, as many of you know, and as we'll learn about more today, this isn't always the case. So think about it this way. You are anticipating a fresh baked apple pie coming out of the oven. And just the sight and the smell of it are really enough to make your gut kick into high gear. And so we'll discuss this whole process as food moves down and through the GI tract, starting from the top. So digestion actually starts in the mouth, where chewing and saliva breaks down food, so it's more easily processed by your body. It then is transferred from the mouth and throat into the esophagus, which is a muscular tube connecting the throat to the stomach. The esophagus contracts as it moves food from the mouth into the stomach, and this process is called peristalsis. So you're swallowing this bite of pie, the muscles in your mouth and throat propel it up to the upper esophagus, and then the muscles in the wall of esophagus create these synchronized waves, where above that morsel or bite of food, the muscles are contracting, but below that bite of food, the muscles are relaxing, allowing the food to pass through without resistance to the lower part of the esophagus. And when the lower part of the esophagus kind of senses or feels that bite of food there's a valve at the lower part of the esophagus called the lower esophageal sphincter, or LES. And this then allows the food to, the esophagus then relaxes, allowing the food to pass in to the stomach through the lower part of the esophagus. Most of the time, the stomach contents and acid in the stomach stay below the lower esophageal sphincter. And while some reflux of contents and acid are normal, gastroesophageal reflux can occur when too much acid or other stomach contents flow the wrong way, sometimes causing symptoms of regurgitation or heartburn. There are other symptoms or disorders related to common conditions of the esophagus. These include esophageal strictures, which is a partial blockage in the esophagus, which can lead to some swallowing difficulty. Also, Barrett's esophagus is a condition where there's abnormal cells at the lower part of the esophagus, possibly increasing your risk for esophageal cancer. And then finally, motility disorders can occur when peristalsis is disordered, sometimes causing esophageal pain or swallowing difficulties as well. So moving on from the esophagus to the stomach, after that bite of food moves from your esophagus to the stomach, that pie or a little bite of food is broken down further. And the stomach has very strong muscular walls. And in addition to storing your meal or holding that food, the stomach's job is to churn and mix the food into smaller and smaller pieces. The digestive glands in the stomach lining produce stomach acid and enzymes, which mix with the food to form a murky semi-fluid mass or paste called chyme. And here, the muscular walls of the stomach, along with the digestive enzymes, mix up the food, further breaking it down And then waves of muscular contractions propel it through a valve called the pylorus or pyloric sphincter, which opens and closes, allowing the food to pass from your GI, from your stomach into the upper part of your small intestine or duodenum. This pylorus opens and closes and might release about 1/8 of an ounce or 4 milliliters of chyme at a time. The rest of it's held back for more mixing until it's small enough to pass through. There's really common stomach disorders that you may or may not have heard of. The first one that we'll talk about briefly is called peptic ulcer disease or ulcers, and this is generally caused by non-steroidal anti-inflammatory medications like ibuprofen or naproxen, but also a very common bacteria called H. pylori can cause stomach ulcers as well. Gastroparesis is a motility disorder of the stomach, which is caused by slow stomach emptying. Here, patients might have abdominal pain related to food, nausea, and vomiting. And then another common disorder is functional dyspepsia. And functional dyspepsia is a disorder where we can't exactly understand why patients have symptoms, but in this case, an upper scope may be normal, and blood tests and motility testing may be normal as well. So moving on from the stomach to the small intestine. The small intestine is kind of the workhorse of the GI tract. It's the longest portion of the GI tract, over 20 feet long. And here, the food continues to break down, enzymes released by the pancreas and bile released from the liver. It's made up of 3 segments: the duodenum, which is the most upper portion and the shortest portion of the small intestine, followed by the jejunum and ileum, which are really mainly responsible for the absorption of nutrients. As bile and pancreatic digestive juices mixed with other juices secreted by the wall of the small intestine and stomach, all of these nutrients are then absorbed through the villi, which serve to increase the surface area of the small intestine, allowing for greater and greater nutrient absorption. And in the intestine, including the jejunum and the ileum, food is broken down into smaller molecules so that it's absorbed. The ileum is really mainly, the ileum is the lower and most final portion of the small intestine, again, responsible for breaking down and absorbing all of the, virtually all of the nutrients that are passing through the GI tract, save for plant-based fibers that can't be broken down all the way. Common disorders of the small bowel or small intestine that you may be familiar with include celiac disease, where the small intestinal villi or those finger-like projections are damaged or flattened related to inflammation triggered by gluten protein that's found in wheat and wheat products. Similarly, Crohn's disease can damage the villi, but in Crohn's disease, there's often seen these small ulcers that you see here that can again lead to damage to the villi and also decreased absorption and abdominal pain. Certainly GI infections like viral or bacterial gastroenteritis can cause disorders of the small intestine. Small intestinal bacterial overgrowth, or SIBO, is also in this category. And also irritable bowel syndrome can affect the small intestine and the colon as well, that we'll get into. In the upper section of your small intestine, or the duodenum, digestion continues as chyme from the stomach mixes with a variety of digestive juices from your pancreas, liver, and gallbladder. The pancreas is tucked just behind the stomach, and it produces digestive enzymes that help break down proteins, carbohydrates, and fat. The liver is responsible for many things, including producing bile, a solution that helps you digest fats. It also helps to filter the blood that's absorbed and filter the nutrients that's absorbed from the small intestine going to the liver, which then can pass throughout the body to nourish all of the other cells and organ systems that require the nutrients absorbed from the GI tract. The gallbladder stores the bile that the liver is making. If the bile is not necessarily needed at the time that the liver is producing it, the gallbladder can store it and save it for a time when it's needed, especially after a fatty meal. There's several disorders that are associated with some of this pancreaticobiliary system. The pancreas can be sometimes inflamed, which can lead to a pretty painful condition called pancreatitis. If the pancreas isn't able to make the enzymes that are needed by the GI tract, that can lead to some difficulty with absorption or malabsorption with pancreatic insufficiency. And then finally, pancreatic cancer can occur involving the pancreas as well. The liver is the most common disease of the liver is fatty liver disease, which can then sometimes lead to inflammation. Cirrhosis of the liver or scarring of the liver can be triggered by medications, infection, alcohol, and fatty liver disease as well. And the gallbladder may be affected by gallstones, which could cause intermittent abdominal pain, usually in that right upper quadrant of your belly. And then the gallbladder can also become infected, leading to fever and pain as well. As the residue passes from the small intestine into the colon, nearly all the water is absorbed. This 5 to 7 foot long muscular tube connects the small intestine to the rectum, and the real job of the colon is to absorb water and process this waste so that defecation can then be easy and convenient. The muscles in the wall of your colon separate this waste into small segments that are pushed through from your lower colon and into your rectum. And it's made up of 3 parts here. The ascending on the right part of your body, the transverse colon, which moves the stool, at this point it's called stool, from the right side to the left side across your abdomen, and then the descending or left colon and the sigmoid colon connecting to the rectum. Common colonic conditions, of course, include constipation, diarrhea, which may be actually normal from time to time, irritable bowel syndrome, ulcerative colitis, where there's inflammation in the walls of the colon, sometimes causing diarrhea and bloody diarrhea, and then colon polyps and cancer. Colon polyps are actually fairly common. About 20 to 30% of individuals have colon polyps on colonoscopy, and if they're not removed, they may go on to become colon cancer. We're almost done here, down to the rectum and anus, and the rectum is a 8-inch chamber that connects the colon to the anus. The rectum receives stool from the colon and sends signals to the brain that if there's stool to be evacuated, alerting the brain that this might need to happen in the near future. But if that's not possible, it can also relax and expand, holding stool until evacuation is convenient. As the rectal walls are stretched, they signal this need for a bowel movement. The anus is comprised of several muscles, the pelvic floor muscles that kind of hold everything intact, and then 2 anal sphincters, the internal sphincter and external anal sphincter, that can relax and contract as needed. And all of these muscles together work to control defecation. Their jobs are to detect rectal contents and can really sense whether they're liquid, gas, solid, and then they can control when stool should and shouldn't be excreted from your body. Common anal rectal disorders include anal fissures, which is a tear in the anal skin at the outside of the anus, hemorrhoids, engorgement of the blood vessels that are draining the anal rectal muscles, fecal incontinence, which can include both loss of control of gas as well as stool, pelvic floor dyssynergia. Pelvic floor dyssynergia is when the anal rectal muscles aren't coordinated in order to have a quote-unquote normal bowel movement. And then finally, rectal prolapse is where the lining of the colon or the rectum can come through the anal canal, causing some discomfort and feeling of incomplete bowel movements or incomplete evacuation. So as we stated earlier, the vast majority of the time, your GI tract is working under the radar to perform this vast number of functions, digestion, absorption, all to nourish not just the GI tract, but all of the cells in your body. And most of the time, we're not even really aware of the fact that this is happening. When this doesn't happen, we may become symptomatic, and there can be a lot of reasons for this. This can include disorders of the gut-brain interaction. There can also be perturbations in the GI microbiome contributing as well. Finally, nutritional causes may be playing a role in the imbalance or balance of the GI tract and all of its functions. And some of this we're going to learn about later today. So thanks for your attention. I think that we have a great program for you today, and I'll be here throughout the day to take any of your questions if needed. See you soon.